Hi friends, in this topic of general examination, today I will talk about the pulse volume. First is the disclaimer. Caring Docs YouTube channel does not provide medical advice and information available on this channel does not offer the diagnosis or advice regarding the treatment. Information provided by this channel is for educational purpose only and it should not be used as an alternative to healthcare professionals' diagnosis or treatment of any person or animal. Please seek the help of medical expert for diagnosis, prevention and treatment of medical illnesses. There is no endorsement for any brand or a company. Friends, the volume of pulse, also known as amplitude, expansion or size of the pulse, it is an extent to which an artery expands during systole or diastolic states. It is related to amount of blood which is pumped with each heartbeat or the force of each contraction. A normal pulse is strong and regular and can be felt with gentle pressure on the artery. A weak or thready pulse is difficult to feel and can be easily obliterated with slight pressure. Strong pulse indicates good blood flow, while a weak pulse can indicate poor blood flow or decreased cardiac output. Volume of the pulse, it is the measure of the pulse pressure. The pulse pressure is the difference between the systolic and diastolic blood pressure. Volume of the pulse, it is better assessed in carotid, but we can assess the volume in the radial arteries also, but it is better appreciated in the carotid pulse. So the volume is assessed by the pulse pressure. Pulse pressure is the difference between the systolic blood pressure and diastolic blood pressure. Normal pulse pressure is 30 to 60 mm of mercury. When the pulse pressure is less than 30 mm of mercury, we call it as a low volume pulse or hypokinetic pulse. The low volume pulse or hypokinetic pulse is seen in patients with congestive cardiac failure, hypovolemia, shock, mitral stenosis, aortic stenosis, and constrictive pericarditis. The pulse volume in aortic stenosis, we call it as a pulsus minimus. When the pulse pressure is more than 60 mm of mercury, we call it as a high volume pulse or hyperkinetic pulse, and it is seen in various physiological states like fever, pregnancy, alcoholism, and patients while doing their exercises or any person doing their exercise. Pathological causes of hyperkinetic pulse or high volume pulse are high output states like anemia, beriberi, hypercarbia, cirrhosis of the liver, thyrotoxicosis, AV fistula, Paget's disease of the bone. Cardiac causes in which we see high volume pulse are aortic regurgitation, severe mitral regurgitation, complete heart block, patent ductus arteriosus, rupture of sinus valsalva, and aortopulmonary window. When we get high volume pulse in cardiac causes, we call it as a pulsus vagus. As we know that in atrial fibrillation, the atria do not effectively contract, they usually fibrillate, so it does not produce effective contraction and we get varying volume of the pulse in the atrial fibrillation. Anisophrygmia is a condition where we get varying volume of the pulses in bilateral brachial or radial vessel and it is seen in Takayasu arteritis. Quanta effect is in supravalvular aortic stenosis, pulse volume is better appreciated in the right upper limb as compared to the left due to selective jet of the blood flow directed to the right subclavian vessel. The patients with pulsus alternans, pulsus bigeminus, and pulsus paradoxus can have abnormalities in the volume of the pulse, which I will discuss in my subsequent videos. We usually grade the pulse on the basis of volume. When we don't feel any pulsation, we grade it as a 0. When we feel small or feeble or reduced pulsation, the grading is 1. The pulse when it is palpable but diminished as compared to other side, we grade it as a 2. Normal pulsation which are felt in both sides, we grade them as grade 3. Patients with high volume or bounding pulsation, we grade them as a grade 4 pulse. So the factors which affect the pulse volume are cardiac output, blood pressure, arterial compliance, and peripheral resistance. The clinical significance of the pulse volume is that it is an important indicator of cardiovascular health, and changes in pulse volume can indicate various conditions such as cardiac failure, hypovolemia, shock, valvular diseases like mitral stenosis, aortic stenosis, high output states like anemia, beriberi cirrhosis, and these conditions I have already discussed in my previous slides. Bill H. Warren has said, wear, wear the white coat with dignity and pride. It, sorry. Bill H. Warren has said, wear the white coat with dignity and pride. It is an honor and privilege to get to serve the public as a physician. With this, I conclude my today's topic. In next video, I will talk about the character of the pulse. Keep learning. Thank you very much. Today is Independence Day in India. Jai Hind, Jai Bharat.